This presentation, entitled Active Transport, Global Guidelines and Objectives by Leilani Hipa, Joanna, Phillip and Ismael Sabido, is a proposal for the World Health Organization Executive Board to advance increased accessibility to modes of active transport through the 2020 World Health Agenda. Evidence exists to show the substantial benefits to health for all through addressing the burden of non-communicable diseases through increasing physical activity. Increasing global rates of active transport will mitigate the impact of climate change by reducing CO2 emissions from transport pollution. This proposal will demonstrate the extent of the issue, who is affected, the determinants of this problem, and what inclusion in the 2020 World Health Agenda will look like. Currently, over 90% of the world's urban population is exposed to air pollution levels that exceed World Health Organization recommendations, causing 4.2 million deaths every year. Furthermore, chronic exposure to air pollution is linked to premature mortality, cardiovascular disease, stroke, respiratory diseases, type 2 diabetes, obesity, and dementia. Motor vehicle dependency have greatly contributed to air pollution and emissions of greenhouse gases. The pollutants are released into the air via exhaust pipes along with the physical breakdown of vehicle and road parts, which contribute to poor air quality, climate changes, and negative public health outcomes. Air pollution in low-income countries has been increasing, while high-income countries have seen a gradual decrease in air pollution, mainly due to clean air programs and policies that reduce air pollution. Over 90% of air pollution-related fatalities occur in low and middle-income countries, mostly in Asia, Africa, and the Eastern Mediterranean region. The associated premature mortality causes premature withdrawal of labour, stunting economic and social sustainability, which further increases economic discrepancies and inequities in the most susceptible populations. Motor vehicle dependency has also resulted in physical inactivity for many, leading to a worldwide upward trend in body mass index, non-communicable diseases, and the associated burden of diseases, causing more than 38 million annual deaths of capable working citizens aged 30 to 70. Active transportation, such as walking and cycling, is a cost-effective way to integrate physical activity and can reduce air pollution by decreasing motor vehicle dependency. Air pollution is directly responsible for the link between climate change and poor health outcomes. Transport accounts for 14% of all global sources of greenhouse gas emissions, a significant contributor to the acceleration of climate change. Air pollution significantly impacts global child health, accounting for almost 1 in 10 deaths in under 5-year-olds. Children are more vulnerable than adults to air pollution. They breathe more rapidly and absorb more pollutants. Children are generally shorter and are therefore more likely to absorb pollutants reaching peak level of concentration. Exposure to high levels of air pollution affects 98% of under 5-year-olds in low and middle income countries compared to 52% in high income countries. Health inequity is also perpetuated through global use of high emission vehicles. High income and more developed countries are gradually shifting towards lower emission and electric vehicles. However, older polluting vehicles are exported and sold at lower prices to lower and middle income developing countries. Air quality is a strong indicator of urban health. Low air pollution can occur in well-planned cities, the result of accessible public transport systems, walkable streets and cycle lanes, together with ample parks and green spaces to filter air and to encourage being actively outdoors and exercising. A shift from dependence on private motorised transport use towards use of alternate modes of transportation has immediate and long-term health benefits. The use of public and non-motorised transport improves physical mobility, safety, and independent access to key destinations. Potential physical health benefits include reduced cardiovascular and respiratory disease from air pollution, less traffic injuries, and less noise-related stress. Increased physical mobility contributes to the prevention of non-communicable diseases. Improved active transport together with upgrades of urban walkways and creation of cycleways is more cost-effective, equating to a 25% greenhouse gas mitigation potential. Local investment in active transport subsequently reduces road congestion and also lowers cost of funding road infrastructure. Use of alternate modes of transport helps to close the equity health gap. This is most beneficial to low and middle income urban areas where the most rapid urban population growth, worse traffic congestion and air pollution occurs. Similarly, vulnerable groups including women, older adults, children, people with disabilities and lower income groups have less access to private vehicles, a barrier to accessing economic and social opportunities. The challenges are global urbanisation is on the increase. 50% of the world's population currently lives in cities, and this number is expected to grow to 2/3 by 2050. People move to urban areas for employment and socio-economic opportunities in an attempt to promote their health and well-being. However, excessive urban air pollution in fast-growing cities results from poor urban planning, road transport prioritised over pedestrians and cyclists, heavy road traffic, cramped slums, uncontrolled sprawl of anonymous high-rise blocks of asphalt and concrete. Global emissions are still rising and have already caused warming of 1 degree Celsius. There exists a significant gap in capacity to limit global warming. The target is to keep global warming within 1.5 degrees and global emissions need to be halved by 2030. Accompanying this has been the rise of an obesity epidemic compounded by sedentary lifestyle and lack of physical activity. Transport pollution is also linked to morbidity and mortality rates for other non-communicable diseases. It is imperative to call for action and turn the tide through increasing accessibility to active transport. We acknowledge this approach is only part of a wider solution to mitigate climate change effects. However, active transport is nonetheless integral to achieving co-benefits to health. Given the substantial body of evidence which supports the global benefits of active transport, we urge the WHO Executive Board to raise a call for action starting at the World Health Assembly. Advancing active transport as a WHA agenda topic will provide the opportunity to identify and assemble key stakeholders for the development of an active transport global guidelines and objectives or ATGO document. The subsequent synthesis and analysis of existing research and activities can be used to inform ATGO. Following a review and endorsement by the WHA and WHO, ATGO can then be presented at the 2022 Climate Change Summit as a global guide for active transport, the first of its kind. There is clear, overwhelming global and regional strategic support for increasing active transport. This is evidenced by the abundance of active transport initiatives integrated into organisational frameworks, policies and development projects. Some may argue that associated issues such as the health risk of air pollution and transport-associated incidental injury or death are barriers to active transport in many countries. The evidence suggests otherwise. Consequently, we must now drill down to provide clear guidelines and objectives to implement and measure the health benefit of active transport actions on a global scale. We propose the HWO Executive Committee advance active transport through a guidelines and objective document within the World Health Assembly agenda. We have demonstrated the global epidemiology of climate change impact through air pollution and lack of sustainable transport modes. We have linked this to health through illustrating the determinants which maintain ill health and climate decline. There is currently a call for political action at a global level to develop strategic guidelines and integrate cost-effective interventions to increase active transportation, which will result in air quality improvement and physical activity benefits. Anticipated results provide political leaders with information and a range of cost-effective policy interventions to increase active transportation, assist member states to achieve global targets, provide a roadmap to strengthen surveillance on air pollution and physical activity, particularly in middle and lower income countries, provide a base for active transportation guidelines and encourage improvement in air quality and decrease physical inactivity. It is imperative as a global champion for health equity that the HWO lead this call to action through enduring active transport as a topic on the WHA agenda.